Hello and welcome everyone. Thank you for joining today's session on your favorite channel, Cancer Reach. Cancer Reach is an initiative by our very own tumor defeater, Dr. Krishnamani, to spread awareness about cancer and help patients and caregivers to access the right treatment at the right time. Today, we're here to talk about a serious but important topic, cancer related spinal cord compression. Without much further ado, let me begin with introducing our doctor. So, Dr. Krishnamani has been associated with AOI hospitals in Hyderabad since a decade now. He has expertise in managing both solid and hematological malignancies. He is well versed in delivering advanced treatments such as biological and immunotherapy and is skilled in managing oncological emergencies. He is also actively involved in research and development. A very warm welcome to you, sir.
Hello, welcome to Cancer Reach. Good afternoon to all.
So, sir, can you begin by telling us what is the spinal cord? What are its functions?
See, the spinal cord is in simpler terms, what we call it as a backbone. In layman terms, what we say backbone, it's actually a continuation of your brain and goes down in your spine. That's your spinal cord. So that's a part of your nervous system, which connects your brain to the rest of the body and goes via the spine, from which all the nerves come out for your functioning. So the spinal cord is basically divided as a cervical spinal cord, the neck, dorsal spinal cord, the thorax, lumbar spinal cord, the lower back, and the sacrum, the lowest most part. So cervical, dorsal, and lumbar spinal cord. Okay, the final part is the sacrum. So the function of the spinal cord is it's a part of the nervous system and it is essential for the neurologic functioning. That includes movement of your hand, movement of your legs, that is motor functioning, sensory functioning, that is to perceive things hot, cold. It is also essential for your bladder function, for your bowel function. So these are all the functions of a spinal cord. And because of the spinal cord, we as human beings or primates, we stand erect. Unlike an animal which is quadriplegic, which walks on all the four legs. We rather walk on our legs and we stand erect because of our spinal cord, which is a continuation of the brain.
So, sir, today's topic, what is spinal cord compression? Why is it compressed?
Correct. So if you look at the architecture if you look at this anatomical image also, these are all the bones, backbones or the vertebral bones we call. Vertebral bones, within them house the spinal cord. So the spinal cord goes up to the L1 vertebra. So there are 7 cervical vertebra, 12 dorsal or thoracic vertebra, 5 lumbar vertebra. Spinal cord goes up to L1, L1, 2, 3, 4, 5. It goes up to the lower border of L1. So from the brain, from the cervical C1, it goes up to lower border of L1. This spinal cord has all the nervous elements in it. When this spinal cord is compressed, you call it spinal cord compression. So imagine it is the main wire which is supplying current to your body. You compress it or you block it. That means there is no current flowing below the blockage. If there is no current or if there is no nervous supply, or so you don't get any nervous discharge or neuronal discharge from the part which is compressed below. That means wherever you have the cord compression, below that area, you don't have a nervous supply. That means below that area, functioning will stop. Okay, so spinal cord is within the vertebra. Spinal cord is up to the L1 vertebra. Spinal cord, if it is compressed, is called, in medical terms, extradural spinal cord compression or simple spinal cord compression or spinal cord compromise. When you compress it, what happens is the blood supply to the spinal cord dies and the spinal cord at that level stops functioning. If it stops functioning at that level, below that also there is no neuronal discharge. So all the nerves which supply those particular areas are affected. So if your dorsal spinal cord is affected at some level, or your lumbar spinal cord is affected, what happens, predominantly the dorsal, you will have weakness of your lower limbs. You will have loss of sensation of your abdomen. If your cervical spinal cord is affected, your upper limbs are also involved, lower limbs are also involved, because below that everything is cut off. And this compromise occurs in cancers and it's a medical emergency.
So, what are the causes for this in a cancer patient? What causes the spinal cord compression in cancer patients?
Commonest cancers which cause spinal cord compression are breast, lung, prostate cancers, colon cancers, myeloma. So, first things we should think are breast, lung, prostate, colon, myeloma, sometimes even lymphomas can cause, kidney cancers, any other cancer which has spread to the bone or the spinal cord or the spine. So these are your common causes. Since breast and lung cancer and prostate are so common, we see spinal cord compression commonly. Prostate cancer in men has a specific tendency to spread to the bone. The disease commonly spreads to the bone. Like how colon cancer commonly spreads to the liver, prostate goes to the bone. That's why a higher number of people with prostate cancer with bone metastasis can present with spinal cord compression. Same with multiple myeloma. It's a blood disorder, but usually affects the bone, and patients can get spinal cord compression.
So, in any cancer patient, if they are having this spinal cord compression, the first factor to be attributed would be the cancer itself.
No doubt about it. When you have cord compression and you have cancer, you are probably suffering from the cancer spread to the bone, which is compressing the spinal cord.
Who would be at a high risk of getting this based on age, based on gender? Cancers you have already covered, sir. So, based on these two factors.
Age, again, see, cancers are seen in an advanced stage, so maybe those people. Okay. More than the age and gender, it is the volume of disease. Now, somebody who has large amount of disease, who has been neglected for some time or for whatever reason has large volume of disease, that means what? More areas in the body are involved. That means your bone also may be involved. That means you may have a risk of spinal cord compression. Okay. Breast cancer, unattended for a very long time, you can probably develop spread to multiple areas, including bone, including spinal cord compression, prostate cancer. So that is the way you would relate to it. It is not that who is at higher risk. These cancer patients are at the highest risk.
Okay. So, what would be the signs and symptoms of this condition?
First few symptom is pain. Pain usually precedes everything. They may have severe neck pain or severe back pain or lower back pain. That itself tells you which part of the spinal cord, cervical, dorsal, or lumbar is involved. That pain may be remaining there or it may radiate along. So if you have neck pain, then the spinal cord compression here, the pain may be in the neck which radiates to the shoulders. If you have dorsal pain, it is pain radiates to the chest. Lower lumbar spinal cord involvement here, it may have pain radiating to the tummy or the abdomen. So pain. Next thing is loss of sensation. Next thing is loss of motor activity. That means they have difficulty in using their hands, difficulty in walking, slippage of chappals while they are walking, difficulty in moving one step over the other during when they're walking stairs. So the patients may say, I have severe back pain. I am unable to move. I am unable to use my leg. I don't have power in my leg like before. I have a heaviness in my legs, heaviness in my hands. Okay, when I'm moving, I'm having severe pain in the back. That movement is causing excruciating pain. So, pain, difficulty in walking, or difficulty in any kind of movement, sensory issues in the form of tingling and numbness. Hmm? And finally, they can lose bladder and bowel control. Patients may say, I'm unable to use my leg. I have slowly lost power. From the last 1 week before or 10 days before, I used to walk well, then suddenly developed back pain. My legs became heavy. I was not able to use my legs. I barely could walk. Now I'm unable to walk also. I am unable to even move my legs on the bed. And I am not able to feel my bladder. Without knowing, sometimes they evacuate the bladder, or they say, I don't know, and I'm not able to pass urine. And when you examine, the patient has urinary retention, or they are constipated for many days. That means those nerves are damaged, they are cut, and the nerve is unable to empty the bladder or the bowel. That's why they are constipated or they have voiding difficulty. So these are all the symptoms. So you should act immediately at the sign of pain. If you act after the power is gone in the limbs, after the patient is not moving the legs or the hands, then even if you treat the cord compression, the power in the legs and hands is not going to come back. So why this is a medical emergency is you should act swiftly. The patient and the doctor should act swiftly. The patient at the slightest complaint should go to the doctor. We should assess the damage and interfere even before the patient loses power. Once the power in the legs or the hands is gone, nothing we can do.
So, sir, you saying that we need to act promptly at the site of pain itself. So, does that mean you would be giving the patient something like kind of a first aid before even coming to the diagnosis part of it?
See, we'll go step by step. So when you said diagnosis, now we have to prove. So anybody who comes with cancer pain in the back doesn't have spinal cord compression. So how do you diagnose? With these symptoms, with a history of cancer, if somebody comes first to do an MRI of the spine. Don't think twice. X-rays and CTs will not help you much. Blindly go for an MRI. If MRI says there is cord compression, then you should see which part of the cord is first involved, how severe it is. Is the full cord compressed, severe cord compression, or no, or mild? Just it is pressing on the cord. And at how many levels is the cord compressed? At multiple levels or at a single level? And what is the clinical condition of the patient? Does he have any deficits? Deficits means, does he have any problem moving his legs and hands? Power in the hands and legs is okay. So your diagnosis is based on MRI. If this is the first time somebody is coming to you, obviously, as we have discussed, you will also do a biopsy. You will not wait for a biopsy, because by the time you wait for a biopsy and you want to start treatment, this patient may permanently lose his legs, power in the legs. Got it? So you will do an MRI. Once the MRI says this is cord compression, you'll act swiftly. Now coming to your question of first aid. The first and foremost thing is you have to reduce the pain. Give analgesics. Second, immobilize the patient. This patient should not move around walking, talking, drinking, lifting heavy weights, driving, running, jumping. You are going to immobilize the patient. Now you look at your images, in the MRM images beautifully at multiple places, they all show cord compression. So what you are going to do is ask the patient to lie down flat on a bed. Major movements obviously should not be done. Give analgesics to reduce the pain. The patient is usually started on steroids. We go with a drug called dexamethasone steroids. What happens is the cord is a small area. It will have a lot of swelling also. Steroids help in reducing the swelling. So when the swelling reduces also, the cord gets some place to breathe. Understand, the spinal cord is a very tight space. It is not a big room. So in that small space, if there is edema or in swelling, apart from the tumor, if you reduce the edema or swelling with steroids, even before you start working on the tumor, the spinal cord gets some breathing space. So its blood supply is slightly better. It gets better oxygen. So the first thing is start steroids. Then you treat the cord compression. You do either surgery or you do radiation, or if it's a lymphoma, give chemotherapy. So immobilize, painkillers, analgesics, steroids, which is dexamethasone, and then go for the area based on the disease, based on the number of levels of cord involved, general condition of the patient. You will take an opinion regarding surgery, a neurosurgical opinion, or palliative radiation, or if it's an extremely chemosensitive disease, you will think about chemotherapy.
So, supposing the stage is at a bit advanced and the patient has lost mobility in the hands or say the legs, then what would be the line of treatment for you to proceed?
Once you lose mobility completely, as I told you, it is difficult or almost impossible to get the power back. At that time, you're only trying to salvage the situation, but our intention, that's why, should be prior to that, so that you're able to save the limbs. After that, whatever you do, the patient is anyway going to be on the bed and will require physiotherapy. So if somebody comes with an acute spinal cord compression, the person is in a very good general condition. There is not much of disease elsewhere, like the liver, lung, etc. This cord compression is only at one level. And imagine this patient has no diagnosis of cancer also. Then a neurosurgically intervening there and removing the cord compression will also give you a diagnosis of cancer. Also, immediately you are removing the, what do you say, the pressure, and the spinal cord regains itself. And the power in the leg is, or the hand is taken care of. Suppose you have cord compression at multiple levels. This is the cancer patient who has progressed over multiple treatments. He has only severe pain. Then you will give radiation to reduce the pain. So if there is a single level cord compression with impending deficit, we say that is, this patient is going to get deficits very soon. You have to act swiftly under the cover of steroids and remove the cord compression surgically, which is called decompression. And then you will support on both the bones by doing something called a laminectomy, we say. That is, the spinal cord is supported and from there the compression is removed.
So, sir, a few myths before you give your ending remarks. So, the first one is that only certain types of cancers are at a risk of causing spinal cord compression.
Any cancer which spreads to the bone technically can cause spinal cord compression, but the common ones are the ones we listed.
So, spinal cord compression is always a result of cancerous tumor directly pressing on the spinal cord.
No, you can have it in non-cancerous conditions also, right? Your vertebral body is unstable, you have a fracture, you can have a cord compression.
And the last one, spinal cord compression almost always leads to permanent neurological damage.
No, you intervene early, this patient will have legs and hands and power in his legs and hands. Our aim is he or she should not become bedridden and completely paraplegic or quadriplegic. That is, four limbs is quadriplegic, two limbs in the lower limbs is paraplegic. Plegic means no power. Our aim is to prevent this. So, treat spinal cord compression early, prevent neurological deficits.
Sir, any ending remarks?
So, this is a common emergency we see, and it's a medical emergency. Breast, lung, prostate, myeloma, lymphoma are your commonest cancers. Other cancers can also cause. You have severe back pain, one of the earliest symptoms. You start developing heaviness in your legs or hands, unable to move your hands and legs for finer movements or gross movements like walking. That or getting up from a sitting posture or lifting your arms above your head. Then, with your severe pain, it probably indicates your cord is involved. Go see your doctor immediately. You will need an MRI for diagnosis and a biopsy for diagnosis of cancer. Start treatment immediately, most likely surgery or palliative radiation. This will help us prevent deficits and permanent disability. So, in spinal cord compression, time is the essence, time is the key to prevent deficits.
Thank you for this informative session, sir. And thank you for your insights on managing patients with cancer related spinal cord compression. I thank you for giving us your time for today's session, sir. Thank you so much.
Thank you so much. Thank you.